Well, concerned about the loss of lives to malaria in Nigeria, the federal government is reviewing strategies to eliminate the ailment. Arise Health correspondent Olija Wapera reports on the ministerial meeting on rethinking malaria elimination.
Nigeria continues to battle malaria with a prevalence rate of 22%, accounting for 27% of global cases of malaria.
It is indeed not a compliment that Nigeria bears a third of the global burden of malaria, with the country accounting for 27% of global malaria cases and 31% of global deaths, based on the 2023 World Malaria Report issued by the World Health Organization.
Although the number of malaria-related deaths have reduced, more states in the north still report very high incidences of malaria. In response to this, the federal government is finding ways to combat the crisis through case management, vector control, and medication.
In the area of vector control, we have been able to deploy the use of nets across the country, and we are also looking at the possibility of bringing in some new interventions that we add value.
We need to challenge our assumptions, innovate our strategies, and collaborate more effectively.
The federal government therefore plans to roll out the malaria vaccine soon after determining the most effective distribution plan.
I will set up an advisory on malaria elimination in Nigeria, which is independent, but also combining our external and internal experts anchored around the SWOP that we have had, so that we elevate it at a meta level. Introduction of vaccine, how we do it in a responsible manner. Yes, we've got an application with Gavi, but other considerations, fiscal consideration, operational consideration, how do we build that into our policy and also advise the NITAC? We don't want to go to the global, but there is good evidence, but in the context of Nigeria with 230 million, to bring our minds and see how can we have a push to make malaria medications widely available, very affordable, and of the quality that Nigerians need, that also fit into our local manufacturing capacities.
Health experts here say a data-driven approach and the need for consistent funding to support the prevention of malaria is key.
It's time to turn the tide of this ancient killer. A data-driven approach to identify the most effective and most equitable use of resources to accelerate progress in Nigeria and other high-burden countries.
While tools like vaccines and medicines can reduce the burden of malaria, Nigeria must also allocate more resources and implement effective strategies to turn the tide against this persistent health challenge. Olija Wapera, Arise News.
Well, many thanks, Olija, for that insights. Joining me now is Dr. Godwin Ntadom, who's the National Coordinator of the National Malaria Elimination Program. Good to see you and thanks for your time. You know, if there's anything anyone in Africa, Nigeria in this case, is afraid of, is malaria. Tiny mosquito, killer, and it's crazy. But we'll come back to talking about where we are at the moment concerning the malaria vaccine. But paint for us a picture how far we've gone in the fight against malaria.
Thank you. Good evening, viewers. Nigeria has made a moderate progress. Coming back from 2010, when we had a prevalence of about 42%, and in 2024 that we have a prevalence of 22%. So we've been able to reduce the burden in a way. So less children are dying from malaria now compared to what we have or what we had about 14 years ago.
That's a good one coming from you. Less people die of malaria, but it takes us to the efforts that the world over is putting to ensure that malaria is phased out. The vaccine, which was the big talk in 2023. How far have we gone with that?
Well, when you're talking about the elimination of malaria, there are so many interventions. Some are targeted at the vector, and some targeted at the parasites. They are huge. There are several of them. Vaccine is just one of those ones targeting the parasite in man, and it's not the only. And we keep on repeating, vaccine is good. We have used vaccine in other interventions, polio vaccine, measles vaccine, even the COVID-19 we talked of vaccine.
I was waiting to hear that.
Malaria vaccine has been in development for over 60 years ago, and is one of the very few vaccines against the parasites. All the other ones are viruses, and those are the ones we are familiar with. But the first time we are having a vaccine against a parasite is a great achievement globally. And probably that's why the noise is so much, because that's not the only vaccine in line. And this one has come. And of course, if you look at the, like you mentioned earlier, the burden of malaria in sub-Saharan Africa, and taking Nigeria as the one with the biggest burden. So we look at it as a welcome development, but it is not a magic bullet. When you are talking of vaccine, you continue to talk about the other interventions that have been deployed. With the addition of vaccine, it will be value added.
So speak to us about those others that have been deployed before we come back to vaccine.
Yes, like in the area of case management, that is individual developing malaria. We have adopted the best anti-malaria medicines that are presently. Those are the ACTs. And in the northern part of the country where we have, seasonal rainfall, that means rainfall.
You have to be breaking them down. People will be wondering what's the ACTs.
Okay, artemisinin-based combination treatments. Those are the best anti-malaria medicines available now. And when you go to the northern part of the country where you have rainfall, about 4 or 5 months in a year, and those are the period when you usually have the highest incidence of malaria. Another medicine has been deployed. That is the seasonal malaria chemopreventive treatment for children that are less than 5 years. And with all these interventions, we also have other interventions. We are familiar with the nets we are distributing. The net is actually against the vectors. As long as you sleep under the net every night, you are not likely to get malaria, because the mosquitoes that will cause malaria will usually bite in the evening or from dawn to dusk. So those are some of the other, and we have several others as well. We talk about for pregnant women, the intermittent preventive treatment, where all pregnant women are expected to take sulfadazine pyrimethamine at least monthly, up to 3 or 4 times during the pregnancy. And with this, it is not likely that a woman is going to have malaria. And it is generally advised, when you have symptoms of malaria, test yourself. If it is positive for malaria, you treat promptly. When you treat to clear the parasites, it is not likely that the mosquito will be able to bite you to get some other parasite, to be able to, because the mosquito needs to bite man to get the parasite before they will transmit it to other people. So if we treat ourselves promptly, when you have symptoms of malaria, you test yourself, you treat, and everyone does that. Then our environments also. You ensure that mosquitoes do not breed around our houses.
Is that possible?
Very possible. One, we know where mosquitoes breed, and those are containers that will contain water. It could be pots, anything that can contain water for a few days will breed mosquitoes, including your swimming pool, including your well. So what do you do is to ensure that mosquitoes don't lay their eggs inside this well, and they don't hatch to become mosquitoes. And just like what we normally promote now is that it is easy for you to destroy all those vectors. One, the larva that causes malaria, they swim around in the water around your places. You can just pour oil, any form of oil, groundnut oil, palm oil, engine oil, kerosene. It will suffocate those.
You know, it's exciting we're having this conversation, and sometimes you ask yourself, how much of sensitization do we get? You're the man in charge, a National Malaria Elimination Program. You're the warlord fighting malaria for us, as it were, in Nigeria. So let's talk about resistant, because I've heard about resistant malaria. You just spoke to us about testing. We've seen a lot of people, oh, I feel unwell, I think this is symptom. You just hazard a guess. Do you have those cases to deal with as well?
Well, when you talk about resistance, you don't say cases, because it's not what an individual will take medicine. Oh, I took anti-malaria, I'm not getting better. The medicine is resistant. No. It's a process. You go through studies. You have to do it in several individuals, you know, to come out. It's possible to have treatment failure. And there are treatment failure is when you take the medicine and it's not giving you the desired result. That's in a case that you've been diagnosed to have malaria, yes, and you take anti-malaria medicine, and yet you are not getting relief. That could be treatment failure, not necessarily resistance. And when you are talking about treatment failure, there are so many factors. It could be as a result of the use of unwholesome medicine, which is fake. It's possible, and fake can come in various, you understand, in our system. I don't want to associate. And there could be, the medicine could be expired or any other thing. So if you could also take the wrong medicine. There are some anti-malarials that already the program has said that they are no longer efficacious in treating malaria. Now, when you have malaria and you use medicine like chloroquine, you are not likely to get the desired result, because those medicines have been confirmed not to be working well again.
And why is that? Is it that the mosquitoes have
Resistance is being confirmed that those medicines have some high level of resistance against. They are no longer responsive. The parasites are no longer responsive to their power. That means they cannot clear the parasite from the blood any longer. So that's why the country came up to adopt the best available medicines, which are the artemisinin-based combination treatments.
Let's wind down and talk about efforts that the government, we'll go back to how we started. Now let's gauge the efforts that the government is making to ensuring that in as much as I try to get rid of open containers of water and clear my drains and even have mosquito nets, there are other people who are not able to do these things, especially those in the hinterlands. What's the government doing to help them?
I think it's even easier in the hinterland to do that. Protecting your environment is easier, because every environment, you see, there's ownership at the rural area. Everybody has his compound, and you have control over your compound. You understand? So it is possible for you to go out to apply some simple measures to control mosquito, unlike in the urban area where the street belongs to nobody and belongs to everybody. So it is, and where we have the problem of malaria, oftentimes is usually in the rural communities, and the factors are clear. A lot of breeding sites, because there are farms, there are, so if in the rural area, apart from promoting the use of insecticide-treated nets, where, of course, when you want to use net, you use it religiously, because you need just one infected mosquito bite to develop malaria. So if you sleep under net every night, it is not likely that you're going to get malaria.
Dr. Ntadom, when you talk about that one mosquito bite, that one tiny mosquito, you've worked, this is an aside, you've been in the lab looking at so many mosquitoes, I'm quite sure.
Yeah.
Well, I'd like to thank you for your time, Godwin Ntadom, Dr. Godwin Ntadom, National Coordinator of the National Malaria Elimination Program. It's a delight speaking with you tonight.
It's my pleasure.